Hi, I'm Eric Eiting here at the Digital Health Summit Studio live at CES. I've got Ginny Fahs here from Glow. Ginny, welcome.
Thank you.
Thanks so much for joining us. So talk to us about Glow. What is it?
So Glow is a data science company, and we empower women with information about their reproductive health. We do that via mobile apps. We currently have 3 mobile apps on the market, and they support women from period to parenting.
So talk to me a little bit more about that. I mean, like what, if I'm trying to, advise one of my patients who's coming to see me about reproductive health, and Glow is the right option for you. Walk us through what the needs are and what they can expect to get from Glow.
Yeah. So Glow is an app that is focused around the fertility experience, figuring out about your fertility. About half of our users on the app are women who are actively trying to get pregnant. And then half of our users on the app are women who are trying to avoid pregnancy but just want to know more about their body and what to expect of their cycle. So it's an app where the user will input data every day. Some of the data is related to her lifestyle, things like sleep and exercise. Some of it's related to her menstrual cycle. Some of it is related to her basal body temperature, which is a really important measurement in figuring out fertility. And then we use data science to produce really accurate fertility predictions so that people know at what time of the month they're most likely to conceive and less likely. And that clearly helps women who are trying to have a baby and those who are not.
And then do you have any information about how effective this is in helping people predict when they're going to be fertile?
Yeah, we've actually found it to be really effective. We recently did a study comparing users who use our app very actively with users who are kind of more passive or only open the app every few weeks or every few months.
Sure.
And we found that women who are actually using the Glow app are 40% more likely to report a pregnancy than women who are not. So we've seen it to be really effective, and we have 150,000 women who have reported pregnancies on our app.
Wow, that's really impressive.
Yeah, it's really exciting.
Well, and I love the idea too that this is something where, because I think it sort of dawns on everyone, that people would historically check their temperature or do things to try and get a sense of when they were ovulating.
Yeah.
But the whole idea of using that not to help you have a baby, but to use that as a form of birth control, I think is an exciting option too.
Yeah, and we actually also just released an app in July called Eve by Glow, and that's an app. It's a much simpler experience. Mostly just menstrual tracking, but it's for women who are actually trying to avoid pregnancy, and it teaches them about birth control, about how to have a happy and healthy sex life. So we're really trying to support women starting as soon as they get their periods, all the way through when they become parents and they're navigating postpartum and things like that.
Wow, that's really amazing. Where can we find out more information about Glow?
So the 2 best resources are probably our website, www.glowing.com, and then we're also on Twitter, Instagram, and Pinterest. Via the handle @GlowHQ, so GLOWHQ.
Great, excellent. Ginny Fahs, thanks so much for joining us.
All right, thank you.
I'm Eric Eiting, live at the Digital Health Summit Studio here at CES.